Dr. Fabiana Castro, assessing delays in the treatment of vitiligo. Second is Ajay Jawan, 308 excimer lamp for mucosal vitiligo. Then Kavita Gandhi, a qualitative interview study exploring the impact of vitiligo among adults and adolescents. Dr. Neha, vitiligo and cochlear damage. And Krishnappa, therapeutic effect of oral vitamin B12, folic acid supplements, and narrowband in vitiligo vulgaris patients.
Dr. Aneja and Dr. Wang, there's 2 questions in the chat box.
Yeah.
Yes, I see one for Dr. Gandhi asking what were the subcultures of the target population and geographic locations of the interviewed candidates?
Yeah, so the patients were actually interviewed from the United States. So we didn't conduct the study in other countries. And in terms of subcultures, we had mostly Caucasian population, and then we had some representation from Black or African American, and about 10% the other cultures, I would say Hispanic and Asian. But that representation was a little low than what we would have wanted in terms of Hispanic Asian.
Wonderful. And for Dr. Deshpande, there was a question regarding the average number of sessions needed for repigmentation on the lips. Dr. Deshpande? Oh, I think you're mute. You might be muted.
Okay.
We can hear you now.
The repigmentation starts around 8 to 12 sessions after starting treatment, and the complete repigmentation happened around 26 to 34 sessions. So around 6 months are required. If you calculate number of sessions per week, we give around 2 sessions per week. So around 8 sessions in a month. So it takes around 6 to 8 months for the around 75 to 90% of repigmentation over the mucosal area.
There were some related questions for you, Dr. Deshpande. Did you, for the starting dose for the excimer lamp, did you start lower than you typically do with non-mucosal sites? And then another question was whether you expect any difference with excimer lamp versus excimer laser.
I will answer second question first. I have no experience about the excimer laser as such. I am using excimer lamp only for last 6-7 years. And the first question is about the difference between the dose, starting dose. Generally, I have started with 50 millijoules of energy from for first session, and gradually I have increased to around 250 or 300 depending upon the response. And once in a week, once in 2 weeks, I used to increase the dose by around 20 millijoules. So gradually from 50 to 70, 70 to 90. So keep on increasing up to 250 and 300. Up to 300, I have given to all the patients without any untoward side effects.
Wonderful. So it sounds like a relatively gentle approach. Another related question for you.
A question for Dr. Neha. Yeah, why did you have an idea of cochlear damage? Did you notice any hearing loss in some of your patients? Dr. Neha, are you hearing me? Dr. Neha Karthik?
So she's not there for the session. Dr. Neha is not there for the session.
Okay. Next question.
Yeah, can I ask
Dr. Majid, please?
Yeah. So basically, question to Dr. Deshpande.
Yes.
What percentage of your patients responded overall? And was the response correlated with the duration of vitiligo? For example, if the duration was less than 6 months versus more than 6 months, did you see any correlation with the duration of vitiligo?
Actually, all the patients for whom I had given a examer lamp, the disease duration was around 2 years and more. And all of them were in stable state. There were no history of new lesions for last 4 to 5 months. Then on number two, what was the second question?
What percentage of your patients responded overall? And was the response correlated with duration?
Yeah, and the number of patients I have treated is around 30, including genital and the mucosal lip lesions. Out of 30, 25%, 25 number of patients responded very well. Almost 85 to 90% of repigmentation was there. Remaining 5-6 patients, they do not show much of response because of some other reasons. I mean, because few patients develop some herpetic-like lesions, so I have to discontinue the treatment. But only because of this reason, I could not continue the treatment. Otherwise, remaining 25 to 26 patients responded very well. And as far as the duration of the disease and the response is concerned, I don't find any difference as such, because all the patients were of duration more than 2 years. So it is not like that.
So any topicals that you're using during the treatment? Any topical treatment?
In between, I was using pimecrolimus.
Okay. So I think Dr. Neha has joined, so she can respond to her question. Dr. Neha, can you hear us?
Yes, doctor, I can hear you.
Okay, so the question for you is that you reported cochlear damage. So do the decrease? Yes. Do the decrease in audiometry is clinically relevant? Did you find any hearing loss, any sensory hearing loss in any of your patients, or was it just the audiometry? So,
sir, actually, the audiometry in 2 groups of patients, which is the localized and the generalized group. And the right side and the left side of the sensory neural hearing loss was compared, sir. So it was found that the sensory neural hearing loss by pure tone audiometry was decreased in the right side of a few patients.
Okay.
I have a question about that. I wonder if there are, that it was so unusual that there would be a laterality to the hearing loss, or at least something that I wouldn't have expected. Is there something that, is there a hypothesis as to why that might be?
Sir, there's no particular hypothesis that would relate that there's more sensory neural hearing loss comparatively to the right side. But there is a hypothesis relating to the melanocytes that they come from the same neural crest.
And Dr. Harris had a follow-up question to ask whether the hearing loss was clinically significant and whether the patients sensed that hearing loss or whether it was something that was just detectable on audiometry.
A few patients did have significant sensory neural hearing loss, sir, and a few were only detectable by pure tone audiometry.
And I had a question for Dr. Lopes as well. Very interesting evaluation of causative factors for delay in treatment. As part of your poster, you reported that folks with less than 25% body surface area involvement seem to get treated more quickly than folks with more significant involvement. I was curious whether there was it was a little bit unintuitive result, and I was wondering if there was a hypothesis as to why that might be the case.
Yes, thank you for the question. Yeah, we also found very interesting this result, and we didn't see any difference, like statistically significant difference in different parts of the body, but maybe people with less BSA might have more lesions on face or genital area that could lead to a more rapid treatment. Dr. Kavina Patel helped me with the study. Maybe she could also answer.
Also, one of the reasons that we were thinking that it might be that case is because if people are affected for a larger body surface area, they might just have thoughts that like, oh, it's already spread this much, there's no need to get treatment. And sometimes people with shorter body surface area affected or less have a more acute onset, and so they might be more pressed to get treatment sooner.
Great. Dr. Harris had another interesting question for Dr. Neha. With relationship to the laterality of the hearing loss, was there a relationship with laterality with vitiligo in those patients as well?
So is this question pertaining to the right and the left side of
Correct.
the
Yeah.
sensorineural hearing loss?
Yeah, just if the hearing loss was on the right, was the vitiligo more on the right, and the same with the left, or was it unrelated?
So actually there was no sort of laterality as for that aspect, sir.
I think we have time for one more question if anybody has any pressing questions. If not, I had a question for Dr. Gandhi. You reported that there was itching and swelling in 15 to 20% of the adult patients with vitiligo, but none reported in the adolescents. And I was wondering, it was just an interesting finding, whether that there was a thought as to why that might be the case.
Yeah, we did not study causality. Like this was more through concept elicitation, where we asked patients in terms of their symptoms and the impacts. And about 20% of them reported, among adults, they reported itching and swelling. And we did see that, there was also a BSA correlation where, as the body surface area tend to increase, we saw more of those type of symptoms being reported. But we didn't study the causality.
Thank you to everyone for wonderful work that you've done and sharing your results with the rest of the community. I think Patrick is cueing us to move on to our next speaker, and so if there are no other questions, I'll propose that we kind of close the poster session.
Yeah. So thank you everyone for participating in this session. It was nice learning from all of you. Thank you so much.